Okay, we'll kick off. So thank you so much to everyone for taking time out of your lunchtime, time out of your day to join us. I hope it will be really valuable for you. So my name is Kira. I'm going to be moderating the webinar today. Just a couple of housekeeping notes to start. Everyone will be muted throughout the webinar, but if you do have any technical issues or difficulties, you can type into the question box and I'll do my best to assist you there. Also to note as well, this webinar is being recorded and we're going to send out a recording afterwards to your emails. So you don't need to worry about taking notes during the webinar. You can just sit back and relax. I also want to thank everyone who did submit questions in advance. We received lots of really, really good questions. So my colleagues are going to address those throughout the webinar. And then we'll take a few extra questions at the end as well. So without further ado, I'll pass it over to Anita now to kick us off.
Thanks, Kira, and hello, everyone. So before we get into the webinar presentation, I just want to briefly introduce you to our audiology team here at Neuromod Medical. So firstly, we have Caroline, who is our clinical director and also a qualified audiologist. And then we have Christy, Helen, and myself, who are all clinical audiologists here at Neuromod Medical. So today it'll be myself, Christy, and Helen who will be giving you an insight into different aspects of tinnitus. We're going to cover topics such as what is tinnitus, treatment options for tinnitus, how neuromodulation and the Lenire device can help with tinnitus, and also the results of our clinical trials. As Kira mentioned, we received all your questions and we have incorporated them into our presentation today. And we'll also have some time at the end for any further questions. So just to begin, what is tinnitus? So tinnitus comes from the Latin word tinere, which essentially means to ring and is often referred to as ringing in the ears. So clinically, we would refer to tinnitus as the perception of sound that doesn't have an external source. And as I mentioned, it is often referred to as ringing in the ears, and the majority of people would describe their tinnitus as a ringing sound. However, people experience tinnitus in different ways, and many other people would describe their tinnitus as a buzzing sound, a humming sound, hissing or whistling sound, or even a combination of sounds. It can be continuous, fluctuating, or intermittent, and can present itself in one or both ears, in the head, and for some people, they actually find it difficult to pinpoint the location of their tinnitus. There can be many causes of tinnitus, but one of the most common causes is hearing loss. So when somebody has a hearing loss, there is a lack of auditory input or stimulation being sent from the ear to the hearing center of the brain. And as a result, the brain is deprived of auditory activation and rewires itself in a process known as neuroplasticity. And it is believed that these altered brain patterns are what produce tinnitus. So hearing loss as a result of the aging process is one cause that can result in these changes, but other common causes include a perforation, middle ear infection, noise exposure, and for some people, their tinnitus is not associated with any particular cause. But no matter the cause of tinnitus, there are different treatment options to help people better effectively manage their tinnitus to a point where it is no longer a problem. So these treatments include tinnitus therapy, sound therapy, hearing aids, medication, and neuromodulation. And it is important to note that not every treatment option will be suitable for every person. I'm going to discuss the options of hearing aids and tinnitus therapy in more detail in a moment, and then I'll pass it over to Christy, who will speak more about neuromodulation. But before we move on, I would just like to briefly discuss sound therapy and medication. So with regards to sound therapy, tinnitus is typically more noticeable in quiet environments, and many people with tinnitus have found that using background noise can help distract them away from their tinnitus and listen to something more soothing and pleasant. Some of you might already be aware that you generally don't notice tinnitus as much when there is background noise. Now, the background noise itself can be something as simple as the radio, TV, or music, or you can also play different natural sounds like the wind, rain, white or pink noise. We did get a question in from somebody who mentioned that they have difficulty with sleep, and we're just looking for a little bit of advice on that. And sound therapy can be something that's very beneficial in helping people who have difficulty getting to sleep because of their tinnitus. We do recommend to use something like a nature sound, white noise or pink noise, as opposed to the TV or radio, but it is down to personal preference as well. And then with medications, there is no medication available specifically for tinnitus. Some people have been prescribed certain medications by their GP to help with things like stress, anxiety, and sleep. But as I said, there's nothing specifically available for tinnitus. The medications that have been proposed and investigated, there are some safety concerns surrounding them, and the benefits do not outweigh the side effects. So much more research needs to be done there. But then moving on to tinnitus therapy. So we are very aware that tinnitus can have a serious impact on a person's quality of life. It can trigger things like anxiety, stress, and depression, and interfere with sleep and concentration. So with tinnitus therapy, it can be very beneficial when somebody is experiencing this negative emotional reaction to their tinnitus. It aims to implement psychotherapy into the management of tinnitus by offering behavioral, humanistic, integrative, and cognitive approaches to tinnitus management. So what I mean by that is, and a behavioral approach focuses on normal and abnormal behaviors, and in essence, the person's concerns in the here and now. A cognitive approach looks at thoughts, actions, and feelings, focusing on current issues. A humanistic approach is based on the principles that everyone has their own unique way of looking at the world, and this can impact your choices and actions. And an integrative approach combines these different therapies to fit the individual needs of the person. So when somebody is experiencing feelings of stress, anxiety, or depression, we can't directly change how we feel, but the way we behave and think, we can kind of indirectly change them. So tinnitus therapy aims to target a person's negative thoughts towards tinnitus and teach coping mechanisms and skills to improve quality of life. This is a collaborative kind of thing between the patient and the therapist to help reduce the emotional reaction and attention given to tinnitus, reduce stress through relaxation techniques and mindfulness, and ensure that tinnitus does not affect your life activities. As audiologists, if we feel that something like this will be a suitable option, we have previously referred patients externally to a therapist or to their GP, but we have found that there was a significant clinical need for this service. So the main reason that many of these services, and the main reason for that was because many of these services had long waiting lists, and not every therapist has experience with tinnitus. So we are now delighted to offer a tinnitus therapy service here at Neuromod Medical, and we have a very qualified psychotherapist who is now working with patients to help better manage their tinnitus. Another treatment option is the use of hearing aids. So with hearing aids, they should be considered for people who are aware of tinnitus and have a hearing loss. Essentially, what a hearing aid does is it looks at pitches or frequencies that are below normal on your hearing test and amplifies those sounds to a more audible level to make things such as speech more clear and more sharp. It is important to note that a hearing aid should be programmed for each individual person based on their hearing loss. So hearing aids can be beneficial for managing tinnitus because, as I mentioned, altered brain patterns due to lack of auditory input or stimulation from the ear is believed to produce tinnitus. And they provide more input or auditory stimulation to the hearing center of the brain, which can over time help with the perception of tinnitus. As well as this, the hearing aids will give you access to more environmental sounds, which can mask or cover the sound of tinnitus or make it less noticeable over time. The American Tinnitus Association did do some research, and they did find that 60% of patients who have a hearing loss and tinnitus found benefit from using hearing aids on their tinnitus. So it is important that they are considered for anyone who is aware of tinnitus and has a hearing loss, even if the hearing loss is very mild. I'm now going to pass things over to Christy, who will talk you through neuromodulation, the Lenire device, and patient journey here at Neuromod Medical.
Great, thank you, Anita. So as Anita mentioned, I'll be talking through a bit about bimodal neuromodulation and tinnitus, as well as a little bit more Lenire specific in terms of the patient journey when using Lenire. So I'd like to first touch briefly on the history of Neuromod Devices. So Neuromod Devices is an Irish company, was founded in 2010 by Dr. Ross O'Neill, and the aim is to advance the science of bimodal neuromodulation. So at the time, Dr. O'Neill was working as part of a research group with Maynooth University, looking at possible neuromodulation interventions for illusory conditions. Now, illusory conditions are conditions in which the nervous system is perceiving something that isn't actually real. So an example of that would be something like phantom limb, but a more common example of that would be tinnitus. And one of the reasons why Dr. O'Neill and his team decided to focus predominantly on tinnitus is due to really just the fact that tinnitus is still, it's a clinical need that's very much still unmet in the medical community. I'm sure a lot of you will know that although a huge amount of people suffer with tinnitus, there's not really a lot of really good treatment options, especially not ones kind of based in science. So it was important to try and bring something to the market for people that is more rooted in a scientific kind of background. So in terms of how bimodal neuromodulation soothes tinnitus, I think it's important to break this down a little bit and just explain a bit of the terminology that we use when we're talking about this. So all of this really boils down to the principle of neuroplasticity. Neuroplasticity is the brain's ability to rewire and learn as we go. So anytime we read something new, see something new, the brain forms a new connection around that. All of that is part of neuroplasticity. So that's really kind of the principle that we're focusing on. The bimodal part of it, really bimodal refers to two different modes. So we've got two different modes of stimulation. So it's auditory stimulation through the ears and electrical stimulation through the tongue. So stimulating two nerves at the same time. So that's where the bimodal section of it comes in. And then neuromodulation really refers to anything that modulates, adjusts, or tunes the nervous system in some way. Basically, anything that makes changes within the nervous system would come down to neuromodulation. So if we look at the auditory system, researchers have discovered over time that if we present certain sounds and stimulate somewhere in the body at the same time, that you can make the brain more sensitive to those sounds, because the sound is basically being reinforced by that paired physical stimulation. So if we present enough acoustic stimulation, the brain begins to pay more attention to and becomes more sensitive to kind of these other different acoustic stimulations or stimuli, and therefore less sensitive to the tinnitus, which should then promote that more positive kind of neuroplasticity. Now, Lenire itself is the first commercially available non-invasive bimodal neuromodulation device for the treatment of tinnitus. Following a number of trials, basically we developed mute button, which then evolved into Lenire. Lenire is currently only available within the EU. We've had a few questions about when it will be available in other countries. We have applied for FDA approval, so that is in the works, but we don't have a timeline on when that will come through. And then hopefully in due course, we'll be able to branch out into even more countries beyond the EU and the US. But unfortunately, currently only available within the EU. Okay, it's non-invasive and it's portable, which means it's for use in the comfort of your own home. It's not something you need to come into a clinic to use every day or anything like that. It's in the comfort of your own home. Lenire is comprised of three main components. So you can see them on the screen there. It's the tongue tip that provides the electrical stimulation to the trigeminal nerve, which runs alongside the tongue. Then you've got the controller, which is kind of about the size of a mobile phone, and that controls the timing and the intensity of the treatments. And then you've got your headphones, which connect up via Bluetooth, and that's what provides the acoustic stimulation to the auditory nerve through the ears. The device is configured like a hearing aid would be according to the patient's hearing thresholds, which is why it's very important for us that all of our patients have an up-to-date hearing test done kind of before we can configure their Lenire device. All right, so if we look at the treatment plan, what this basically is just the structure or the journey of the patient with Lenire. So the first step is always an initial assessment visit. So Lenire is fitted and used as part of a tailored treatment plan prescribed and supervised by a qualified healthcare professional. So as Anita mentioned, not every patient or not every treatment with tinnitus is suitable for every patient, and it's like that with Lenire. Not every patient is necessarily going to be recommended for the treatment. That's why that initial assessment is so important for us, because it's really important that it's not, Lenire is not available over the counter. It's not something that you can just walk in and buy. It is something that's prescribed by a qualified healthcare professional. If you are deemed kind of suitable for Lenire or recommended, then the device fitting visit would take place. That's when we explain everything out about how to use your treatment from start to finish. Make sure that you're happy getting up and running and can conduct your sessions properly in the comfort of your own home. So the sessions or the treatment really consists of 2 30-minute sessions in a day. So one thing to consider before deciding to proceed with Lenire is whether you have the time to commit to it every day. But 2 30-minute sessions, some patients choose to split them up. So to do 30 minutes in the morning, 30 minutes in the evening. Some patients tend to do just a full hour in a go, so doing the 2 sessions back to back. That's really up to the patient how they want to structure it. We do recommend that you keep your sessions in and around the similar kind of time every day, but we're not really seeing any benefit to splitting the sessions or keeping them together. During the sessions, we recommend that you do kind of as little as possible, to use the time to relax, to not to be focused on something else, and not to be watching TV or driving or anything like that, but to use the time as a bit of a relaxation. Also, some patients choose to do some meditation or breathing or relaxation techniques during a session. And all of this can go a long way, even in just slowing down the nervous system a bit and increasing or improving that therapeutic benefit. So after the device fitting visit, you would do that yourself for at least 6 weeks at home. And then we do a follow-up after 6 weeks where we see how things are going, make any changes or adjustments that need making. And then you would use it again for another 6 weeks, and then kind of come back for your second follow-up visit after that. So it is recommended to use for a minimum of 10 weeks, but there's really no end, deadline for the treatment. It is a long-term treatment. So many of our patients choose to continue on even beyond that 10 or 12-week mark. On this screen here, you'll see the fitting protocol. I'm not going to go too much into detail about this. It's really just to kind of make it clear that everything we do here when it comes to Lenire and the fitting and the protocol is very much based on trial data. It's based on, scientific evidence, that we do have a protocol we follow, but that there are different adjustments and things that we can make along the way that can make it a little bit more individualized for each patient. So it's very important to us to listen to our patients. And at any point along the way, if any of our patients are struggling with anything, have any questions, queries, or need any advice, that they're always welcome to reach out to us. We're always happy to offer that. We never want patients to think they can only talk to us in their appointments. Offering that continued support and guidance is very important to us here at Neuromod Medical. All right, then the next thing I'd like to discuss is suitability. So what patients are suitable for Lenire? Now, that's not a very straightforward question to answer for ourselves. It really does depend from patient to patient. There's a lot of different factors that we look at when we see a patient in terms of determining their suitability for Lenire. So it's not something that I can't give you a template or a guideline now in this webinar on who would be suitable, but what we can do is talk a little bit about patients who might not be suitable for Lenire, or patients who we wouldn't recommend fitting with Lenire. So the first thing is we have a fitting range. So when we talk about a fitting range, I'm talking about the audiological aspect of it. So from a hearing perspective, we need your hearing to fit within a certain range in order to fit you with Lenire. So it would need to fit within that green range there on the screen. Now, we obviously know that most patients don't always know how to read their audiograms and compare it to that. So if you're ever not sure, if you'd like to send an audiogram through for us to look at to see if you're within the range, we do that too. We can do that ahead of appointments, but it's really important that we fit kind of within that fitting range there. And then we also have a list of contraindications. So these are things that would render a patient unsuitable for Lenire from the outset. And there's a few different reasons behind some of them. We've had a couple of questions in about what happens if you do have one of the contraindications, if you do have, a pacemaker or anything like that. So typically, patients with the contraindication, we would still recommend have an assessment with us so that we can recommend for them what we think would be the most appropriate treatment plan. And that's going back to what Anita was talking about earlier in terms of tinnitus therapy or hearing aids or sound therapy or something like that. So just because Lenire might not be recommended doesn't mean that there aren't other things that we can discuss with people. But the contraindications, really any form of active implantable device. So for example, a pacemaker or a defibrillator. The main reason we just don't want that kind of interfering with the treatment. We don't want them interfering with each other. really. Pregnancy and under 18 years old would also be contraindicated. Those that population or those populations weren't included in the clinical trials. So we have no data on trials of the device on those patients, so we have contraindicated them. Lesions, sores, or sensitivity of the tongue. The main reason for that is because we're stimulating it. We wouldn't want to either aggravate any pre-existing condition or cause a patient any discomfort doing the treatment. And then epilepsy or other neurological conditions that lead to a loss of consciousness. The main reason for that is because the tongue tip could become a choking hazard if something had to happen in a session. So, in these webinars or in sessions with patients, it's very difficult to say exactly who is suitable, but that's just a bit of an idea of who might not be suitable, and that it's really important for us to conduct a full assessment before we can make any recommendations for our patients. Okay, so I'm now going to hand over to Helen, who will talk a little bit through about the clinical trials.
Thanks, Christy. So yeah, we had a few questions sent in to us in relation to the research carried out by Neuromod, and we hope to answer these questions now by discussing the clinical trial as well as the research itself carried out by the company. So yeah, we've been testing the Lenire device since 2012. Initially, we had two studies. So we had the pilot study as well as the TAV study. So both studies confirmed to us the safety of the device, as well as showing us a significant improvement in patients' tinnitus handicap scores. So this was a fantastic starting point for us, just so we could further our understanding and continue our research on a larger scale. So this brings us to our TENTE-1 trial that I'll chat about now. So the TENTE-1 trial was a double-blinded randomized trial and included 326 participants based in both Ireland and Germany. So it was a 3-arm study, and by 3-arm we mean that we looked at 3 different parameter settings and patient subtypes. So just to elaborate on parameter settings, so the first parameter setting, the tongue and auditory stimulation were in sync, and then with the second setting there's some short delays between stimulations. They were partially synchronized. And finally in the third setting there were longer delays as well as frequency changes, so not completely synchronized. In terms of the inclusion criteria, so patients were aged 18 to 70, and they'd been experiencing subjective tinnitus for more than 3 months and less than 5 years, and they had a baseline THI score of 28 to 76. So patients were recommended to use the treatment for an hour a day, and then the patient's tinnitus severity was calculated using both the THI and TFI. And these are just 2 questionnaires we use to see how tinnitus is affecting the patient's quality of life. So this was recorded at the initial assessment, as well as 6 and 12 weeks during the treatment phase. And then after the 12 weeks, the devices were returned, and then a follow-up with patients was organised for 6 weeks, 6 months, and 12 months after treatment. And at each follow-up, the patients completed the same tinnitus questionnaires, just so we had an indication of their tinnitus severity. So just looking at the results of the study, so there was a significant improvement across all 3 arms of the study. So 86.2% of patients showed improvement in outcome measures after 12 weeks of treatment, with 80.1% reporting sustained improvement right out to 12 months. So which really highlights the long-term benefits of the treatment. In terms of THI, so the average drop in THI was 14 points, which is fantastic considering that 7 points is considered clinically significant, so double that. In terms of the 3 arms, so we didn't notice a significant difference between the arms. However, we did see in some trends in longer term data, which indicate that arm 1 and arm 2 perform better than arm 3. And this is something we hope to elaborate on in further studies. Yeah, so overall what the study showed us was that we can both effectively and safely manage tinnitus, and through the use of non-invasive bimodal neuromodulation of both the auditory and trigeminal nerves. So the treatment also appears to be safe and well tolerated, and we can see this in our high compliance rate of 84%. We also found further benefits by changing the stimulation settings over time, and this is sustained right out to 12 months after treatment. So yeah, just overall very promising results from the paper, and we hope to investigate these findings even further in our 10-day-2 study, which is a paper that is currently in the peer review stage. And we hope to share with you all as soon as it's available. Now, so before we go into a few of the questions that were sent in to us, we just want to share some tips in relation to managing your tinnitus. So firstly, wearing hearing protection. So say if you're exposed to loud sounds or noisy environments on a day-to-day basis, what hearing protection can do is prevent hearing loss or further loss if there's already a hearing loss present. Just because, as Anita mentioned earlier, there is that association between hearing loss and tinnitus. And so we want to do what we can to protect our hearing. Then using a hearing aid if you're experiencing hearing loss. So as you mentioned earlier, when someone has a hearing loss as well as tinnitus, what a hearing aid can do is amplify all sounds so the tinnitus itself is less noticeable. And there's also now different settings that can be applied to hearing aids with the overall aim of masking the patient's tinnitus as well as reducing their perception of it. So thirdly, relaxing. So we had a question sent in to us in relation to the effects of stress and tinnitus. And we would say that reducing stress is very important to the overall management of tinnitus. So just implementing exercise or relaxation techniques into your day-to-day life can help you feel less stress and then provide some relief from your tinnitus. So things like meditation, mindfulness, or even taking a walk can be beneficial in reducing tinnitus-related stress. Another strategy is to take your focus away from the tinnitus with other sounds. So again, we had a comment sent in to us that the person's tinnitus is more noticeable in quiet or at nighttime before they go to bed. So we'd say that the use of background sounds can help you draw your attention away from the tinnitus. So there's lots of different apps out there that provide sounds like white noise and nature sounds. But you can also use environmental sounds from your day-to-day life, like the radio or television, to help with your tinnitus. And the final tip that we would give is to get assessed in some way. So whether that's by your GP to determine if there's any medical implications to your tinnitus, by the audiologist to determine the level of hearing loss, or by a specialised tinnitus clinic like Neuromod Medical. And what we do here at Neuromod is take all the different aspects of your tinnitus experience into account and then create a management plan for you, which is both individualised and tailored to your specific needs. No, so I'll just hand you back to Kira, who I think has a few more questions that have been sent in to us.
Thank you all. Yeah, we have got quite a few questions in. There's actually one I might answer myself first. Christy had mentioned that Lenire is available in the EU, and one person asked a very good question, does that include the UK? And it does, absolutely. So Neuromod Medical, they're taking telemedicine, telehealth online appointments, or you can find your nearest clinic on the Lenire website as well. And next question, Helen, I might pass this one back to you.
Yeah.
So I have had tinnitus more than 5 years. Can I benefit from the treatment? And I believe that's the Lenire treatment.
Okay. Yeah, so to that question, I'd say that although within our clinical trial, the inclusion criteria was to have tinnitus for less than 5 years, in terms of carrying out the Lenire treatment now, there's no time limitations. So we'd say anecdotally that the three of us, we've had patients both online and in clinic who've had tinnitus for far more than 5 years and have benefited from the treatment. So yeah, for that question, definitely a treatment option to look into our Lenire treatment.
Perfect. Anita, I might ask you to take this next one. So sometimes my tinnitus is pulsing or in line with my heartbeat. Can you address that?
Yes. So when a patient kind of advises that they can hear their heart beating in their ears, or there's a pulsatile or pulsing component to their tinnitus, we would often recommend that they go back to their GP for possible onward referral to ENT. The main reason for that is with pulsatile tinnitus, it kind of falls under the category of objective tinnitus. So what I was speaking about there, the kind of tonal, kind of the ringing or the buzzing, the hissing, we would consider that subjective tinnitus. But pulsatile can typically fall under the category of objective tinnitus. And what I mean by that is it's typically a sound that is created by structures in or around the ear. So it is important that you get that further medically investigated. by your GP or ENT.
Perfect, thank you. So the next question is, what side effects can happen with Lenire? So Christy, I'll ask you to take this one, please.
Sure. Good question. It's a question that we do get quite frequently in the clinic also. So in terms of side effects, I'd say the biggest thing that we would see in a fair amount of patients who start with Lenire, especially either in the beginning or maybe after we make a change, is that the tinnitus can fluctuate. So it can get worse before it gets better. So it's important that patients do understand this, because for some people, that might be enough for them to decide that they don't want to try it. And for other people, because what can happen is when the tinnitus increases, it can increase our kind of stress and anxiety around the tinnitus, which can further increase the tinnitus, which can further increase the anxiety, and we can get kind of stuck in that vicious cycle. So I would say the biggest thing we'd see is a typically temporary increase in tinnitus. There's nothing else that we really would consider to be kind of a side effect that we've linked to Lenire at this stage.
Perfect, thank you. Next question here. Actually, this is a question I've seen a few times come in. So is there a link between COVID and tinnitus? And Helen, I'll pass that one back to you.
So I know this is a very topical question at the moment. So yeah, I know the BTA, they published an article last year which reported out of 121 adults admitted to hospital COVID-19, nearly 7% of this cohort reported developing tinnitus. So there is evidence to indicate tinnitus as a symptom of COVID. There was another study that looked into the changes in tinnitus experience during the COVID-19 pandemic. From that, it showed that patients with pre-existing tinnitus that contracted COVID, in 40% of cases, their tinnitus got worse. And then interestingly, in the cohort of tinnitus patients that didn't contract COVID-19, but were still experiencing the pandemic, 32% of their tinnitus worsened. So it just shows the impact of other factors related to the pandemic, so maybe stress or lifestyle changes that can have on tinnitus patients.
Perfect, thank you. Next question here. How come some days I have the symptoms of tinnitus and more days I don't? Anita, can you take that one, please?
Yes. So with regards to tinnitus, it is kind of the nature of tinnitus that it can be continuous, it can fluctuate, and it can be intermittent, so it can come and go. What we do kind of recommend with tinnitus is you may notice some spikes or fluctuations. So what we mean by spike is you might have a baseline where you're kind of not aware of your tinnitus on a daily basis, or you might have to think about your tinnitus to actually hear it. But certain things can cause spikes and fluctuations. So as we already touched on, things like stress and anxiety can have a huge impact on the loudness and awareness of your tinnitus. And there are some other things like alcohol and caffeine that some people do feel like can impact their tinnitus. So it is important to be aware that not all of these things will cause a spike of fluctuation in every patient with tinnitus, but it is mindful to be aware of things that may be going on at the time that you may notice your tinnitus is a little bit louder, or you are more aware of your tinnitus on a particular day.
That's great. Thanks, Anita. Next question. What improvements should I expect with Lenire? It's a good one. Christy, can you take this one, please?
Sure. So in terms of, what we typically see from patients when they use Lenire, the patients who have improvement, it's a really mixed bag of responses. So for some people, improvement can mean a reduction in the volume of their tinnitus. So they might say, it's a lot quieter than it was. It used to be an 8 out of 10 on the loudness scale, and now it's a 2 out of 10. And other patients might say the volume is still the same. It's still the same loudness, but the tone has changed. It used to be quite high-pitched and annoying, and now it's kind of, more of a humming that I can more easily ignore. And then some patients might say the sound itself maybe hasn't changed, but my sleep is so much better than it was before. My concentration has improved. I'm just not bothered by it. Or, I have to really listen for it. When I listen for it, it's there. It's not like it's gone away completely. But it's just not as intrusive as it was before I started the treatment. So there's not really, everyone experiences different things, and there's not really a one size fits all kind of, this is what I expect a patient to experience in the journey. But we do look at not only the tinnitus, but also what we call the symptoms of tinnitus, which is sleep, concentration, and overall mood, because it can have a big impact on those things, even if it doesn't necessarily change the tinnitus itself.
Thanks, Christy. Might actually just ask you one more quick question. You were talking about how and when you can use Lenire, and one person has asked whether you could use it on the bus or whether you need to do it in a quiet place.
We do recommend a quiet environment. The main reason is the headphones, they're not kind of proper noise cancelling. They're just your normal standard Bluetooth headphones. So using it in the bus or in a very noisy environment, we run the risk of a lot of background noise kind of, coming in. And also a lot of people find that loud noise already aggravates their tinnitus. So I'd be a bit worried that the loud bus noise combined with the auditory stimulation from Lenire could really aggravate a bit. So definitely quiet room, or as quiet as possible, is recommended.
Perfect. Thanks, Christy. I think that's all the questions we have time for today. I know we didn't get to everyone's questions, and there were a few more, I guess, individualized questions. So if we didn't get to your question today, we are going to do our best to follow up with you via email. But I do want to thank Anita, Christy, and Helen for their time today. I want to thank everyone for joining us this afternoon. And yeah, we'll be in touch by email. Have a lovely afternoon, everyone.
Thank you.
Thank you.